a series of outpatient services called community mental health centers, which you have 4 here in Nashville. Unfortunately, the funds from the bureaucracy did not follow the consumers into the communities, and the services, therefore, were not provided. Now what you have is people that are over 21 in many cases, because these illnesses strike from 18, 16, 17 to 25, in that range. They are now adults out here. They cannot get insurance, number one, because it's prohibitive. They couldn't afford it if they could get the insurance, and so they're destined to what is available by the public system, which has been reduced because these funds went back into the general fund. And you know, I don't have to tell you here in Nashville right now about the problem we got with revenues in this state. And so even the medications are atrocious. We have this new medicine that I talked to you about a moment ago, costs $9,000 a year. But it is a good investment if you can keep a person out of the institute and away from that $65,000 a year thing. So I would say that a family that's not fortunate enough to have insurance going in when this illness hits and retains it, then you are very quickly going to find yourself broken in an indigent area, because we have good private hospitals. They are tremendously expensive. We have most of the better and more equipped psychiatrists are in those hospitals and are not in the public arena. And so here again, because of the economic situation that many minorities find themselves in, and it is improving somewhat, they find themselves having to use the public system, which in most cases is certainly low in quality, and services really don't exist. And you can name housing, crisis intervention, psychosocial services, even social services, drop-in centers where they can relate to people. We're just now getting started to those, thanks to the consumers themselves and the family movements in this state. So the cost is almost ridiculous.
Yeah. Very good. Ms. Pollard, in reference to the cost, any additional information to add to what Mr. RSinor has given us?
I guess one of the tragedies about mental health is that most people enter the mental health system way too late because it is so expensive. Usually they enter the mental health system when they're in a crisis state and they have to be hospitalized. I would very much like to see the services reach out more to the people rather than the people having to go to the services. And I know that's probably never going to happen. Most people don't want to admit that they've got a problem, you know. And for the population that we're dealing with, they are no more going to walk into a mental health service and say, I need counseling, I'm having a problem. The process is too slow. It takes too long to go through an intake and, you know, and to make an appointment for next week or 2 weeks down the road. I think people would benefit more if services were actually really in the community, but there isn't enough money for that. And I think, you know, I think the schools, you know, there needs to be something done in the schools for children that are, you know, experiencing problems. And I don't know where it stops. I mean, I don't know where it begins, and I don't know where it can end, but it's like we wait too late. It
seems to be an overwhelming problem in terms of trying to even deal with the problems that we have.
Right, and by the time somebody is ready to enter an institution like, say, Middle Tennessee State Mental Health Institution, and we're talking $65,000 a year, you know, that could have helped an awful lot of people.
Before they reach that particular point. Okay, we've got a couple of minutes left. Mr. RSinor, what are some of the additional things that we'd like? Professional training and staff in many of these facilities. I think all of that goes back to money too, doesn't it?
Yeah, oh, yes, it certainly does. And I'll throw one statistic out that amazed me when I first heard it. In the entire United States, it's been reported that there's less than 1,000 psychiatrists or psychologists of the minority and ethnic background. Well, that's completely and totally unacceptable.
That's for all 50 states.
That's all 50 states. And I really don't know what it is here in Tennessee, but it's relatively very few. Now, back to what she was talking about, if you're going to try to ethnically touch people, communicate with them, we've got to correct that some ways. Therefore, we're going to have to open up these universities, open up the aid that we give them to get these people, and there are some intelligent people out there that capable and qualified to fill these bills. So we got to make that happen in order to touch this this population. 40% of the homeless right now in this nation are mentally ill. It doesn't make any difference whether they're black, minority, ethnic. They're there, and they tell me that this next population is going to be even worse. And there's one coming down the pike now called dually diagnosed, which means you're mentally ill on the one hand and you're a drug addicted or alcoholic addicted or something else on the other hand. And so it's not going to go away, and we as a society are going to have to join hands with the families and the consumers and those of us that are in the provider service field to touch these people, let them know that they are welcome. That's why we went to Tuskegee, Alabama last year to a minorities conference, had over 550 people there, and that's why we came to Nashville just up the street here at Maxwell House this past year and had over 250 people there, trying to convince them that, hey, this is an illness. It is not something that you need to be ashamed of. The family didn't cause it. It's a chemical problem in the brain, just like heart disease, kidney disease, pancreas, anything else. And if you had one that had diabetes, you'd get him help. Please reach out and come get these people help because they're suffering and dying. If I could appeal to these people, I would tell them to find here in Nashville at Meharry, there's a group there of families, or go out to the Mental Health Association. They have a group, and we have a group that meets here in Nashville. Find the Alliance for the Mentally Ill and meet with those people and talk with each other, and it is wonderful therapy to help your loved one, because we have found that if you leave it alone, it will not be corrected. And so we're going to have to force this issue to the degree that change is taking place. And so that was what I would tell them to do. Don't be ashamed. Reach out to others.
Very good. The last comment, Ms. Pollard, we've got about a minute and a half before we wrap it up.
Okay, I guess when I look at, you know, how far mental health services have come and how far people have come in admitting that they may have a problem and they need to get help for it. At this time, you know, so many things have changed, but as more and more people need to be entering the system, the services seem to be getting less and less.
Yes.
And I think it's good that we're recognizing that that it's okay to have a mental health problem, you know, that we, you know, but there should be somebody out there to help you when you have that. And it doesn't matter where you're from or who you are. If you need the services, there should be a way to get them.
Very good. And let me thank the two of you for coming by and giving us that information. I know that we could only cover just the top of this as a question today, but nevertheless, I think it did give our audience an idea as to perhaps some of the obstacles that we face in terms of trying to deal with the people who are mentally ill in our society. I think it is, as Ms. Pollard pointed out, that we've recognized it as a problem, but while we've recognized it as a problem, we've cut back on the resources that at one time were available in terms of dealing with it. But nevertheless, I think that we are on the correct route in terms of recognizing it as a problem. And let me thank both of you for giving us that information today. And let me encourage you again to tune in next week for another informative edition of Comments. Good morning.